Stephanie's going to transfer to the mat from her wheelchair using a sliding board, and she's going to lead towards her left side, which is her strong side that has good C7 function, and her right side has C6 function. So if you wouldn't mind doing that transfer and concentrate on some of the details of setting up for the transfer. So you first have to remove that footrest. And lock both brakes. And notice Stephanie's right arm kind of acts as a hook to stay with the wheelchair, really uses her right elbow flexors, and then uses her good C7 side to actually place the sliding board. And shows a good head-hips relationship there. Brings her head to her right, to her rear end gets to the left, and rear end has to actually be brought in front of the tire. And she must come forward to get properly placed on the board. Notice this right elbow has to be locked mechanically. She does not have triceps on her right. She really needs to, if I could just stay there a second, she really needs to make sure that this elbow stays locked by contraction of her proximal musculature. Okay. And then her left side has her triceps, so that her elbow can naturally lock that way. Are you going to get your legs up now? Yeah. Your rear end's still on the mat some, is that all right? Mm-hmm. Requires really good stability on her elbows, which requires stable glenohumeral joints. Great. So leg management is a really important component of this transfer, and it makes it difficult when the sneakers kind of add to the resistance of the movement. Good. She has really good scapulothoracic depression to move her body like that. Bob's going to show his techniques that he's learned over the years to transfer. Why don't you roll your chair up and kind of get set up to do a transfer for us. First angles the chair in, and locks his brakes. And Bob makes sure that his casters are rotated in such a way to increase the stability of the chair. And he's also worked his rear end forward to prepare for this pivot transfer. So he uses saliva to increase the friction between his palm of his hand and the surface, and does a great sitting push-up to bring his rear end up and over. How about, if you don't mind, just coming back again? This is really, whole emphasis here is elongation of his upper extremity, and at the same time keeping his elbow locked. And using great head-hips relationship, bringing his head down, bringing his rear end up, and the balance and control that he shows during that activity. Good. You want to try that again? And this time maybe you'll come all the way up over and then show us how you'd get your legs up on the bed as if you were preparing to actually go to bed and go to sleep. Notice the use of the wrist extensors on his left. Keeps his head low to unload his rear end. And the whole scapulothoracic depression is the key here. This activity right here. Great. Just stop right there a second. I just want to emphasize the balance that you have in this point. Can you just kind of put your hands in your lap? Okay. So a lot of this balance is not only Bob's been able to actually control certain spasms in his trunk, but also his abdominal region yields some stability. He's got a low center of mass, and he's actually has just a great sense of balance. And he also has a relatively tight low back that also gives him some kind of an anti-flexion torque to help control his stability. Great. Okay, now what if you were to bring your legs up on the mat? How would you actually do that? And Bob has a lot of spasticity in his lower extremities, and he actually uses this to his advantage. He's now down on his left elbow. That's his central pivot. Excellent. And notice how he just pivots around his midsection.
You want me to go ahead and lay down?
Please. Curt, how long did it take you to learn to transfer independently from the wheelchair to the mat?
Well, it was probably the period of time in and out of the rehab hospital, probably 4 to 5 months before I could transfer independently.
And when you left the rehab center, could you do it by yourself?
Not completely, no. I was using a sliding board, and I believe I could get onto a mat or the bed most of the time, but I couldn't pull my legs up at that point. So it was kind of a learning trial and error after that point.
You eventually got better at it. And how about show us the maneuver now, if you don't mind?
Sure. Just put my chair at a slight angle to what I'm transferring onto. I back up a little bit to get the caster wheels forward. Now I have caster locks to just make the front of the chair a little more stable. I lock the brakes. Twist around a little bit.
Show me that motion again there. That little twist
The
motion
twist?
you had. You tend to hook your right arm around that
Yeah, I hook my one arm. And
and rotate kind of your
And
head
rotate a
this
little
way,
bit.
and your rear end slides the other way.
Right.
Okay.
and I keep one hand on the wheel.
How about, if you don't mind interrupting here, notice the left arm, how he has this nice hyperextended, stable left elbow, and the same thing with the right. And when he keeps that hyperextended elbow, he's really going to add a very powerful scapulothoracic depression at the same time, and he's going to lower his head and show an excellent sitting push-up. And then the next idea is getting your legs up on the bed. That was difficult at first, huh?
Yeah, it was very difficult. Your legs are kind of heavy, and if you have shoes on there, they like to stick to your chair.
Notice the excellent short sitting balance he has, excellent well-developed left wrist extensors. And notice, once you slow down on this just a little bit, and keep going but slow down, notice how Curt's going to push down as far distally on his leg as he can to increase the leverage. It's very difficult to actually get the knee and hip into extension from this position, but go ahead and push your leg out. The idea is to have your push as far down towards the shoe as possible. There's another sitting push-up. Good. But do me a favor and lie your head back down on the pillow, and I'm going to ask you to repeat this activity. So if you'd come up to sitting any way you can, and then get back in the wheelchair.
Well, if I have a chair next to me, I like to grab onto the handrail with one arm. And sometimes I can pull myself up completely like that.
But if you don't mind, if you can go through that one more time, just a little bit slower. Sure. Notice what's going to happen. He's going to use that excellent tenodesis function he has on his right wrist. He keeps his wrist hyperextended, maximally elongating his finger flexors, and he uses that passive tension to maintain the PIP joint's inflection. Now, when he stabilizes the distal part of his upper extremity, he's then going to contract his right elbow flexors, his right anterior deltoid, and he's going to time a push with his left upper extremity. And once he gets to this position right here, he's going to throw his left elbow behind him and hang over his left shoulder and come on up. Now, this is all done without any tricep function whatsoever. Do you like getting your feet on the wheelchair or the ground? Or does it matter?
For me, it works better to put them on the chair. Again, I do have caster locks on the chair, and that helps the front end stay more stable when you've got weight on the front and not on the back.
Can you hold this right here? I just want to point to the extremely well-developed wrist extensors that you have on your left. So much more on your left than the right. Okay.
Pants stuck on the brake. Some are a little more graceful than others.
That's excellent. Jason, would you transfer on the mat for me, please?
Sure.
What I do is I use my legs to get my body out. So I bring myself down and actually bring my hips out before I transfer. It's a process that works for me of kicking my legs and my body out. Sometimes with my spasms, it can help kick them out to get my hips out.
So you really use your wrist extensors there to do that, don't you?
And then I turn also, using my handlebars to get my hips out on the very edge of my seat.
Really challenges your short sitting balance and your short sitting push-up. Get your head down and bring your rear up. and up. Excellent. How about if you could just center yourself on that mat if you would. Good. Once you do that activity, then go down like you just did, then come back up. Now push straight up. That really is an excellent use of that transfer of the iliotibial band from the posterior deltoid to the triceps to give you that elbow stability. Great. How about now, can we do the return move now? Can you,
Okay. Is there any particular way you would like me to sit up?
any way that you feel most comfortable?
Okay.
And then we'll just transfer back. So you make sure that your feet are secure on the ground or on the foot plates.
No, I have them on the foot plates because then it's like your thighs are at the same height as your seat cushion. That helps a lot, especially in uneven transfers. This one's pretty much level though, so it might not make a difference.